Imagine you can't see properly anymore. Everything is blurry and cloudy. You're going blind. So you go to the medieval doctor for help. But instead of giving you safe medicine, he takes out a sharp needle and starts stabbing it directly into your eyeball. Why? Because he thinks he can push the cloudy stuff out of the way by poking around inside your eye with a knife. Today we're discussing one of the most horrifying chapters of medieval medicine that will make you so grateful for modern eye doctors. We're talking about medieval eye surgery, and trust me, by the end of this video, you'll never complain about getting an eye exam again. But before we get into the really scary stuff, if you love learning about terrifying historical facts like this, make sure to smash that like button and subscribe for more shocking tales from the past. And stick around until the end because I'm going to tell you about the most extreme eye surgery method that involved, well, let's just say it involved fire and live worms. Alright, let's jump back in time to when people let strangers stab needles into their eyeballs. So here's the thing that's going to blow your mind. For over 1,000 years, people across medieval Europe genuinely believed that the best way to fix eye problems was to literally stab them with sharp objects. This wasn't just some random crazy person's idea. This was official medical knowledge taught in medical schools. Doctors, scholars, even really smart people all believed that poking around inside someone's eyeball with a needle was perfectly normal medicine. The most common eye problem back then was cataracts. That's when your eye lens gets cloudy and you can't see clearly. It's like trying to look through a dirty window. Today, we have amazing laser surgery to fix this safely. But medieval doctors? They thought the best solution was to take a sharp needle and literally push the cloudy lens out of the way. This procedure was called couching, which sounds innocent, but it was absolutely terrifying. The surgeon would take a long, thin needle, sometimes made of bronze, sometimes iron, and they would stick it right through the white part of your eye, into the eyeball itself. Can you imagine volunteering to let someone do this to you? But people were so desperate to see again that they would actually pay doctors to stab their eyes with needles. And get this, they had no anesthesia. No pain medication. Nothing to make this bearable. People would have to be held down by multiple assistants while a doctor literally stabbed around inside their eyeball with a sharp piece of metal. The surgery involved pushing the cloudy lens down to the bottom of the eye, hoping it would stay out of the way so light could get through. Sometimes it worked for a little while, but most of the time, it made things way worse. Medieval medical texts describe this procedure like it's no big deal. They'd write things like simply insert the needle and push the opacity downward as if they were giving directions for cooking dinner, not stabbing someone in the eyeball. The craziest part? Sometimes people would actually get a little bit of vision back. Of course, what they didn't realize was that this improvement usually only lasted a few days or weeks before infections, bleeding, and other complications made them completely blind forever. Can you imagine living in a time when the advanced medical treatment for eye problems was literally having someone poke around inside your eyeball with a dirty needle? It sounds like something out of a horror movie, but this was everyday medicine for medieval people. Now here's where things get really horrifying, because medieval eye surgeons had an entire toolkit of scary instruments designed specifically for stabbing and cutting eyeballs. The most common tool was the cataract needle, a long, thin piece of metal that was sharpened to a point. Some were straight, some were curved, and some even had little hooks on the end. These needles were usually about as long as your finger and sharp enough to pierce through anything. But wait, it gets worse. They also used tiny knives called eye knives that looked like miniature swords. These were used to make cuts in the eye when the needle alone wasn't enough. Imagine someone taking a tiny sword and slicing into your eyeball. Some medieval eye surgeons even used instruments that looked like tiny spears. They would heat these up over a fire to sterilize them, but really, they were just making hot, dirty pieces of metal that they would then stab into people's eyes. And here's the most disgusting part, they would use the same instruments on multiple patients without properly cleaning them. They might rinse them in water or wine if they felt like it, but usually they'd just wipe them on a cloth and move on to the next patient. Can you imagine the infections this caused? People would come in with one eye problem and leave with deadly infections that could kill them. The surgical technique was absolutely brutal. First, they would have several strong people hold the patient down, and I mean really hold them down, because once that needle went into their eye, people would thrash around in agony. Then the surgeon would use his fingers to pry the patient's eyelids open as wide as possible. No gentle medical instruments, just rough fingers pulling your eyelids apart until it felt like they might tear. Next came the actual stabbing. The surgeon would carefully aim his needle at just the right spot on the eyeball and then stab. Right through the tough outer layer and into the soft, jelly-like inside of the eye. But here's where it gets even more terrifying. They would then start moving the needle around inside the eyeball, trying to hook onto the cloudy lens and push it out of the way. Can you imagine feeling a sharp piece of metal moving around inside your eye? Sometimes the lens would break apart during this process, and the surgeon would have to fish out the pieces with tiny tweezers or hooks. People would be screaming in agony while someone dug around inside their eyeball with multiple sharp instruments. And if the first attempt didn't work, they'd try again. Some patients went through this torture multiple times because the surgeon thought he just needed to adjust his technique. The whole procedure usually took about 10 to 15 minutes, which might not sound like long, but imagine 15 minutes of someone stabbing and scraping around inside your eyeball while you're fully conscious and can feel everything. Now you're probably wondering, who are these people performing eye surgery with needles and knives? Well, the answer is going to shock you. Anyone could be an eye surgeon in medieval times. There were no medical licenses, no training requirements, no tests to pass. If you owned a sharp needle and claimed you knew how to use it, congratulations, you were an eye doctor. Some were actual physicians who had studied at universities and learned from medical books. These were probably the safest option, but even they were working with completely wrong information about how eyes actually work. But many eye surgeons were just traveling con artists who went from town to town, promising to cure blindness with their special techniques. They were like the used car salesmen of medieval medicine. They'd say anything to get your money. These traveling eye surgeons were called oculists, and they would roll into town with a cart full of scary-looking instruments, claiming they had amazing success rates and secret techniques that other doctors didn't know. They would set up in the town square and give dramatic demonstrations, sometimes even paying people to pretend to be cured patients. Step right up. See how I cured this man's blindness with just one simple needle treatment. Some of these traveling oculists became incredibly famous and wealthy. There was this one guy who called himself the Master of Eyes, who traveled all around Europe in a fancy carriage, wearing expensive clothes and claiming he had cured thousands of people. Of course, what he didn't mention was that most of his patients either went completely blind or died from infections shortly after his treatments. But he would be long gone by then, off to the next town to find new victims. Even barber surgeons got in on the eye surgery business. These were the same people who cut hair and shaved beards, but they also performed surgery on the side. Can you imagine getting your hair cut in an eye operation from the same person? The scariest part was that some of these amateur eye surgeons genuinely believed they were helping people. They weren't necessarily trying to scam anyone. They really thought that stabbing eyeballs with needles was good medicine. There are records of some medieval eye surgeons who kept detailed journals of their procedures, documenting hundreds of operations and proudly describing their successful techniques, even though most of their patients probably went blind. One famous medieval oculist claimed he could tell just by looking at someone's eyes whether they had hot cataracts or cold cataracts, and he would use different needle techniques for each type. Complete nonsense, but people believed him because he sounded confident and scientific. Some eye surgeons even specialized in treating eye injuries from battles and accidents. Medieval warfare involved a lot of arrows, swords, and other weapons that could damage eyes, so there was unfortunately plenty of business for anyone willing to try to fix wounded eyeballs. But here's the most insane part: some of these medieval eye surgeons actually developed reputations as miracle workers. Word would spread that a particular oculist had amazing success rates, and people would travel for hundreds of miles just to have their eyes stabbed by this one special doctor. Of course, their success was probably just luck, or the fact that some eye conditions improve on their own over time. But back then, if someone's vision got a little better after surgery, the surgeon got all the credit. Alright, now let me tell you about some of the most insane and absolutely horrifying eye surgery cases that were actually recorded in medieval medical books. Remember how I promised to tell you about the treatments that involved fire and live worms? Well, here we go. Some medieval doctors believed that certain eye problems were caused by excess heat in the eyeball, so they thought the solution was to burn parts of the eye to cool it down. They would take red-hot pieces of metal and literally brand the eyeball or the area around the eye. Can you even imagine agreeing to let someone burn your eyeball with a red-hot iron? But people were so desperate for any chance at better vision that they would try anything. There was this one medieval eye surgeon who claimed he could cure blindness by inserting live worms into people's eyes. He believed that certain worms would eat away the bad humors that were causing vision problems. This guy would actually catch specific types of worms, and then use tiny tweezers to place them directly onto the eyeball. Patients would have to lie still for hours while worms crawled around on their eyes. Can you imagine the feeling of worms moving around on your eyeball? Even worse, some doctors thought that maggots were the best eye treatment. They would deliberately let wounds around the eyes get infected and full of maggots, believing that the maggots would eat away the diseased parts and leave healthy tissue behind. There are actual medieval medical texts that give detailed instructions for maggot eye therapy, including which types of flies produce the best maggots for eye treatment. It's absolutely disgusting. Some medieval surgeons performed what they called eye bloodletting. They would make cuts around the eyes to let out bad blood that they thought was causing vision problems. People would sit there bleeding from multiple cuts around their eyes while the surgeon explained how this was going to cure their blindness. There was this one particularly crazy procedure where surgeons would stick needles through the back of people's heads, trying to reach the eyes from behind. They thought that approaching the eye from a different angle might be more effective than going through the front. Can you imagine having someone stick a long needle through the back of your skull, hoping it would somehow fix your eye problems? The fact that most people died from this procedure didn't seem to discourage doctors from trying it. Some medieval eye surgeons believed that you could cure blindness by removing the entire eyeball, cleaning it, and then putting it back. There are records of doctors actually taking people's eyes completely out of their heads, scrubbing them with various liquids, and then trying to stuff them back into the eye socket. Of course, this never worked and usually resulted in immediate, permanent blindness if the patient survived at all. There was this one medieval eye specialist who claimed he could transplant eyes from dead people into living patients. He would collect eyeballs from corpses and try to surgically implant them into blind people. Naturally, this never worked either, but he convinced several desperate patients to let him try this horrifying procedure. Can you imagine agreeing to have dead person's eyeballs put into your head? Some doctors tried to treat eye problems by drilling holes in people's skulls near their temples, thinking this would relieve pressure that was causing vision issues. They would literally take a drill and bore holes into living people's heads while they were awake. There are records of one medieval surgeon who performed over 50 of these skull drilling eye treatments in a single year. Most of his patients died, but he kept detailed notes about his techniques and continued to offer this service. And here's the most extreme case of all. There was this one doctor who believed that the only way to cure serious eye problems was to completely remove both eyeballs, soak them in a special mixture of herbs and animal blood for 3 days, and then sew them back into the patient's head. This procedure took nearly a week to complete and had a 100% failure rate, meaning everyone who tried it either died or went permanently blind. But this doctor genuinely believed he was on the verge of a major medical breakthrough. Now you're probably wondering, if these treatments were so horrible and dangerous, why did people keep believing they worked? Well, here's the thing that medieval people didn't understand. Sometimes their brutal treatments actually did seem to help a little bit. But not for the reasons they thought. You see, many eye problems are actually caused by infections or inflammation. When medieval doctors stabbed eyeballs with hot needles, they were accidentally sterilizing some areas and killing harmful bacteria. The heat would actually help fight infections, just not in the way they intended. Plus, some of the herbs and substances they used in their eye treatments actually did have natural antibiotic or anti-inflammatory properties. Things like honey, certain plant extracts, and even some of the weird animal products they used could actually help reduce infections and swelling. So occasionally, people really would feel better after these horrifying treatments, which just convinced everyone that stabbing eyeballs with needles was good medicine. And here's something really sad. Sometimes the treatments were so traumatic that they would damage the eye's pain nerves completely. Once those nerves were destroyed, the person wouldn't feel pain anymore, so they thought they were cured even though their vision was actually much worse than before. Also, many eye conditions naturally get better or worse over time regardless of treatment. So if someone's vision happened to improve a few weeks after eye surgery, the surgeon got all the credit even though the improvement probably had nothing to do with the needles and knives. Medieval people also had a very different understanding of how the body worked. They believed in something called the four humors. Basically, they thought all diseases were caused by imbalances of different fluids in your body. So when they poked holes in your eyes, they genuinely believed they were letting out bad humors and restoring balance. But here's what's really crazy: even when these treatments obviously didn't work, people still believed in them. If someone's condition got worse or they went completely blind, doctors would just say, well, the problem must have been more serious than we thought, or we need to try an even more powerful treatment. It's kind of heartbreaking when you think about it. People were suffering through these horrible, torturous procedures because they genuinely believed it was their only chance to see again. And doctors were trying their best to help, they just had completely wrong information about what was actually causing the problems. The placebo effect was also really strong back then. When people expected a treatment to work, and when everyone around them believed in it, they were more likely to report feeling better even if the treatment was actually making them worse. Plus, medieval people didn't really have any better options. If you were going blind, you could either try the scary needle treatment or just accept that you'd never see again. When those are your only choices, even a horrifying procedure with a tiny chance of success starts to look appealing. So what were the real results of medieval eye surgery? Brace yourself, because the truth is absolutely horrifying. Most eye surgery patients in medieval times either died from infections or went completely blind within a few weeks of their procedure. The success rate was probably less than 5%, and even successful cases usually only provided temporary improvement before things got much worse. The biggest killer was infection. Remember, they were using dirty instruments and had no understanding of germs or sterilization. When you stab someone's eyeball with a contaminated needle, deadly bacteria get introduced directly into one of the most sensitive parts of the body. Many patients developed what we now know as endophthalmitis, a serious infection inside the eyeball that can spread to the brain and cause death within days. Medieval people had no antibiotics to fight these infections, so once they started, there was usually no stopping them. Even patients who survived the initial surgery often went completely blind because the procedures caused so much damage to the delicate structures inside the eye. The lens, retina, optic nerve, all of these crucial parts could be permanently destroyed by poking around with needles and knives. Some people developed chronic pain that lasted for the rest of their lives. The eye surgery would damage nerves in ways that caused constant agony, but medieval doctors had no effective pain medications to help these suffering patients. There are records of entire families going bankrupt paying for multiple eye surgeries for one family member, desperately hoping that the next procedure would finally work. People would sell their homes, livestock, everything they owned, trying to pay for treatments that almost never helped. Many medieval eye surgery patients also developed severe depression and mental health issues. Can you imagine going through such a traumatic, painful experience and then ending up worse off than when you started? The psychological damage was often as bad as the physical damage. Some people became permanent invalids after botched eye surgeries. Not only would they be blind, but they'd also have ongoing health problems from infections and complications that affected their entire body. There are tragic stories of young people who had minor vision problems but went completely blind after trying medieval eye surgery. A person who could see a little bit before surgery would often end up with no vision at all afterward. The worst part is that many of these eye problems could have been prevented or treated much more safely with proper hygiene and basic medical knowledge that wouldn't be discovered for hundreds of years. But here's something that might surprise you: despite all these horrible outcomes, medieval eye surgery did contribute something to modern medicine. Some of the basic concepts about eye anatomy that medieval doctors developed were actually correct, even if their treatments were completely wrong. And believe it or not, the idea of surgically treating cataracts by moving the lens out of the way was actually not that far off from some modern techniques. Of course, today we do it with lasers and microscopic precision instead of dirty needles, but the basic concept had some merit. So there you have it, the absolutely terrifying world of medieval eye surgery. Can you imagine living in a time when going to the eye doctor meant having someone stab red-hot needles into your eyeballs or put live worms on your eyes? The craziest part is that people genuinely believed this was cutting-edge medicine. Doctors thought they were saving lives by burning and stabbing people's eyes, and patients were grateful for treatments that we now know were basically medieval torture. It just goes to show how incredibly far medical knowledge has advanced over the centuries. Today we know that most eye problems are caused by infections, genetic factors, injuries, or age-related changes, not imbalances of mystical humors that need to be poked out with needles. And thank goodness we have actual anesthesia, antibiotics, sterile instruments, and real eye surgery performed by trained specialists instead of random people with sharp objects and good intentions. So the next time you complain about getting an eye exam or needing glasses, just remember, at least your eye doctor isn't trying to cure your vision problems by stabbing live worms into your eyeballs with a red-hot needle. If you enjoyed learning about this horrifying piece of medical history, make sure to smash that like button and subscribe for more terrifying historical content. Drop a comment below and let me know, would you rather have modern LASIK surgery, or would you be brave enough to try medieval needle in the eyeball treatment? I think I know what most of you will choose. Thanks for watching, and I'll see you in the next shockingly educational video.